As of noon today, 599,595 Oklahomans have registered through the portal to get their notifications of eligibility. 96,158 appointments have been scheduled. And we're very pleased with the fact that we're nearing 600,000 people registered and 100,000 appointments scheduled through the portal. I do want to remind everybody that the priority groups that are eligible for vaccine appointments include healthcare workers, expanded healthcare worker groups such as allied health fields and general outpatient health services, first responders, and then Oklahomans age 65 plus. So as more Oklahomans will begin scheduling their second dose appointments, we're receiving additional questions about that second dose process. So let me give you a little update there. First of all, if you have received specific instructions for scheduling your second dose at the provider where you received the first dose, you should follow those instructions. If you did not receive specific instructions when you received your first dose, you may use the vaccine scheduler portal to schedule your second dose appointment. These appointments will be marked as second dose or booster appointments only. Reminder, the portal is tied to our public health pods. These pods have access to both Pfizer and Moderna vaccine, as well as the OSA system that can help identify which first dose you received. We know a lot of people have concerns about trying to match up their appointment with their particular brand of vaccine. So with that in mind, and also for planning purposes, which includes the need to understand vaccine amounts, appointment slots, and types of vaccine, we strongly suggest you get your second dose to the same county health department as you received the first dose. It's not a medical requirement, and therefore it's not mandatory. However, excessive deviations from this plan have the potential to create logistical problems that may impact availability of vaccine. We plan for our booster clinics and that second dose, the type of vaccine available, we plan that looking back to the previous 3 and 4 week periods so we know what is coming up. And the only way to do that is plan by location where you received your first doses. That's why we have that suggestion. Here are some other considerations regarding the portal. Keep in mind the vaccine scheduling portal is not the only means to get an appointment and get vaccinated. It's tied to our public health pods. We are collecting contact information for those individuals that are unable to access and utilize the portal. That information is then shared back with local health jurisdictions, and efforts continue to get those individuals vaccinated either through that local health department or through local pandemic providers that are working together with the health department. Also, we have other partners and venues that are offering vaccinations and using an appointment system of their choosing. We do not require any of these facilities to use our vaccination scheduling portal. We recognize that this massive effort requires multiple solutions and multiple options. But at the end of the day, please remember, all these options remain limited by vaccine supply. That is our number one driver on how many tools we can pull out of the toolbox and use to get vaccine administered to Oklahomans. So if you're having trouble scheduling your appointment, please be patient. Please continue to check the vaccine scheduler portal link provided to you by email for new appointments. Watch for local communication about other opportunities to get vaccinated. These will grow over time as the vaccine supply allows. We have been informed that we will receive a 16% increase in vaccine supply next week. This is primarily due to an increase in our Moderna supply. This equates to a total of 103,350 doses expected next week. That is combined from all sources. Keep in mind, this includes all inventory. Most of that vaccine or much of that vaccine next week will go to second doses as we keep our word to prioritize that booster shot. Additionally, we've been told that this number should be consistent over the next 3 weeks.
According to state data, minority populations are being under-vaccinated compared to majority populations in the state. Are there any mechanisms in place or being thought about to increase the number of folks in those populations to be vaccinated?
So yeah, that's something we do watch closely, and we want to make sure that we have a program that includes good health equity and that we are equitably distributing vaccine based off of race and demographic factors in the state. Looking at the numbers we receive, unfortunately, we have a gap. About 23% of the people that are registering and coming through are not revealing race. So I've got almost a quarter of the data is missing there. Regardless, we go off what we have, and we're several percentage points below where we need to be, for example, on our African American population. So with that in mind, we have a minority health work group that's part of our vaccine planning team. They're reaching out to partners, working with partners to try to get vaccination clinics that are focused in some of these areas that we can better serve these populations and make sure that our vaccine distribution is equitable based off of the state's demographic makeup.
We have an update on the Spanish portal. We've spoken to a few of the Hispanic population, Hispanic community who are over 65, and they're really having a difficult time because some of them do live alone. So they're missing out on that opportunity to get vaccinated. So do you have an update on that by chance?
I don't have a specific date. It's in the works, but what we're also trying to do to expedite that is work on like a Spanish tutorial that can be almost like a companion to the existing portal to help with that. Our comms team is working on that right now. We recognize that this is an area that we've got to get going as fast as possible. It's the Microsoft, the full version of the Spanish one is one of the priorities on our list. And I don't know exactly what the estimated completion date is yet, though.
Okay. Do you have some sort of advice that you would provide that specific group? Something that they could do to make sure that they do get vaccinated within these next few weeks?
So actually, those are groups that we're also looking at trying to provide some targeted clinics to assist, as we talked about, like the African American community. We want to make sure that these minority groups are tended to, and we're able to reach them, and that we are providing equitable access to vaccinations. So I would anticipate looking for some opportunities to get vaccinated in some areas that may even fall outside of the portal scheduling tool. We talked about bringing on some pandemic provider partners that would not be using the scheduling portal. That may be a good mechanism by which to help get them vaccinated. And then always we encourage everybody, I know you mentioned those that live alone, but work with neighbors, friends. This is a time for all Oklahomans to pull together. We're moving forward with this. Really, I know it seems painfully slow, but it's actually moving pretty quick when you're trying to address all these issues at the same time. So it's really an opportunity for all Oklahomans to come together, be a neighbor, work with each other, and try to assist wherever possible while we continue to make improvements on the technology side that will reach these groups.